Remember that kid in high school who secretly pulled an all-nighter to study for a test you all agreed to take easy, so now they get an A while you're stuck with B's and C's? Well, Medicaid cuts are like that kid, but way bigger and way more expensive. Because when you cut into Medicaid, you cut into the economy. So whether you have private health insurance or Medicaid, these Medicaid cuts can end up costing us all. As of the date of this filming, which is Monday, May 26, 2025, the reconciliation bill, which contains these massive $625 billion in Medicaid cuts over the next 10 years, has already passed the House. And if it passes the Senate and makes its way over to President Trump's desk for signature, then it'll soon be enacted into law. So yeah, things are moving quickly. But no worries, because I'm gonna help you catch up by reviewing 3 ways these cuts could impact you, whether you have Medicaid or private health insurance, and more importantly, what you can do to prepare and save money. Hey, and welcome to Insured and Informed. I'm Shamy, I'm a healthcare finance professional and your go-to girl for health insurance and policy breakdowns. So whether you want to learn how to pick a plan or read a bill, or just figure out what all these health headlines actually mean for you, please like this video, subscribe to this channel, and comment down below. First and foremost, Medicaid cuts could end up increasing state taxes. So Medicaid is financed by both the federal and the state government, with most funding coming from the federal government. With these Medicaid cuts, states could end up increasing their taxes to help make up for those losses in order to continue supporting Medicaid. These tax increases would be greater in states with lower per capita income, such as Louisiana and Mississippi, than it would be for states with higher per capita income, such as New York and California, because lower income states receive a larger portion of their Medicaid funding from the federal government than higher income states do. What this essentially means for you is that you're going to want to protect more of your money from the IRS if possible. And luckily, the reconciliation bill makes that a little bit easier with the expansion of health savings accounts, or HSAs. Contribution limits to HSAs will double in 2026 from their values in 2025. In 2025, an individual can contribute up to $4,300 to their HSA, while families can contribute up to $8,550. But in 2026, individuals will be able to contribute up to $8,600 to their HSAs, while families can contribute up to $17,100. The bill also allows you to use your HSA to pay for your gym membership and expands the group of people eligible to contribute to an HSA to include people such as those with spouses who have flexible spending accounts, or FSAs. Check out a link in the description for more HSA expansions to help you protect your money. Secondly, cutting Medicaid could result in increased healthcare costs for all of us. Medicaid cuts could result in doctors and hospitals receiving lower rates for taking care of Medicaid patients, which they would then shift onto people with private health insurance to help keep their doors open. See, government payers such as Medicaid and Medicare typically don't pay hospitals enough to cover the cost of care, so hospitals negotiate higher rates for the same services with private health insurance companies to cover this difference. Medicaid cuts are expected to decrease Medicaid enrollment by around 10 million people by 2034. And loss of coverage will mean that former Medicaid beneficiaries will delay care until they're really sick and wind up in the ER needing care. But because they won't be able to pay for these services, hospitals will have higher uncompensated care. Normally, states would step in to help out hospitals with this care, but since their budgets will be slashed, they won't be in a position to do so as much anymore. So hospitals might respond by increasing the rates that private health insurers pay to compensate for these losses. In sum, decreasing Medicaid funding could increase the cost of services for people with private health insurance. And one of the ways you're going to want to defend against this is by taking advantage of the free preventative services that your health insurance company provides to help keep you out of the hospital. These services include things like annual checkups, certain screenings, and vaccinations aimed at early detection and prevention to lower the cost of care for you and for the entire healthcare ecosystem. But in case you do wind up in the hospital, you're going to want to prepare for this by funneling as much money as possible towards your HSA, as discussed earlier, to help pay for your care with pre-tax dollars. Last, but certainly not least, Medicaid cuts could result in some Medicaid beneficiaries falling through the cracks and losing their coverage. By now, you've probably heard of the Medicaid work requirements, which are a part of this bill. They apply to able-bodied individuals between the ages of 19 and 64. And if you're a part of this group, you're going to have to demonstrate that you worked or participated in a qualifying activity, such as community service or being a student, for at least 80 hours a month in order to obtain and maintain your coverage. States will have to provide exemptions to these groups, which are generally going to be low-income pregnant women, disabled individuals, and certain parents, among others. But a couple of problems arise as states roll out these requirements, which might cause you to lose coverage. This is based on the results of Arkansas's 2018 Medicaid work requirements, which found that Medicaid work requirements don't increase employment, but decrease enrollment instead. Well, why, you might ask? Well, first, the Medicaid employment rate is already quite high. An overwhelming 92% of people on Medicaid already work or would qualify for an exemption, according to the Kaiser Family Foundation, an independent organization on health policy research. Second, like Arkansas, states will likely try to use payroll or other data to automatically identify if Medicaid beneficiaries in their system meet these working requirements or meet the exemption status. But problems could arise if these systems are not effective at capturing people's work and exemption status. This is especially true for people who work multiple part-time jobs or have inconsistent working hours, such as Uber drivers or contractors on TaskRabbit, whose full working history might not be accurately captured in these systems. This is exactly what happened in Arkansas in 2018, which caused 18,000 people to lose their coverage, many of which already met the working requirements or exemption status. To help protect against this, you're going to want to keep receipts of your work or qualifying activity like you are a real housewife preparing for a reunion.
Do you want me to bring the receipts? Do I need to bring the receipts, baby girl? Because I got receipts.
You're going to want to keep things like pay stubs, timesheets, volunteer hour logs, and student enrollment verifications in case you have to actively report your work requirement. You work hard, and the last thing you want to happen to you is to lose your benefit because of an administrative error. And finally, another reason that could cause you to lose coverage is if states don't reach out to you to communicate these requirements in the first place. See, implementing Medicaid work requirements effectively requires extensive education and outreach to communities in order to ensure compliance. In Arkansas, some people reported not being contacted, and some who were contacted were left uncertain and confused about whether these requirements applied to them. So, if you can, you're going to want to be as proactive as possible about obtaining this information by going on things like your state's Medicaid website, going to Medicaid enrollment centers, and attending public hearing on Medicaid costs. Now, I know it's frustrating to have to do someone else's job for them, but it beats not doing it and being punished for it anyways. I hope this video helped you understand the broad impacts of Medicaid cuts, and I'd love to hear your comments down below. And if you like health policy breakdowns like this, please like this video and subscribe to this channel. Thank you, and I'll see you next time.